Tamara Thomas, Editor-in-Chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. I'm Tamara Thomas, Editor-in-Chief of Urban Health Today, and I'm speaking with Dr. Imamu Tomlinson, CEO of Vituity. He's here to talk about the dearth of physicians of color in the healthcare system and what effect this lack of representation has in medicine. Thanks for speaking with me today, Dr. Tomlinson.
Oh, thank you so much. Thank you for having me.
Awesome. Let's get started. Can you talk about your background as a physician and a healthcare CEO? You mentioned being one of the few Black CEOs in healthcare. And by the way, congratulations on recently making the list of Modern Healthcare's 50 most influential clinical executives.
Oh, absolutely. I appreciate it. It's a great honor, and I appreciate Modern Healthcare for reaching out and recognizing me. I think, as you mentioned, there are not many Black CEOs in general, and specifically Black CEOs in healthcare. There are lots of reasons for that we're probably going to talk about today. But mostly I think it has to do with a lot of factors, but mostly just not enough presence in healthcare.
Which we're going to talk about today. So according to the Association of American Medical Colleges, as of 2018, the percentage of active Black physicians is 5%. It's 5.8% for Hispanics, 17% for Asians, and 0.3% for American Indians. What do you think is happening that medical schools are not graduating more physicians of color?
Yeah, significantly less than the population when you look at those percentages. I think that medical schools are trying. I think they're trying to make sure they reach out and identify populations in these demographics and have them matriculate and have them graduate. But I think that they're sometimes maybe looking for the wrong thing or looking in the wrong places. I think that medical schools may need to focus more on, diversity of experiences as a reason to be accepted and be successful in medical school, rather than just, sort of the rote sciences. And clearly from those numbers, you can see that the way they're sort of looking at who can be successful in medical school, that this needs to be dramatically changed.
Now, in a perfect world, how would you change that? So you're on the admin of a medical school. You're on the admin, the admitting committee. What one thing would you change or tweak that you think would make a difference in enrollments?
Yeah, I think the first thing is to really look at weighting experiences. And I think if you look at medical schools, and it's not their fault. They have lots of applications. It's highly competitive, but mostly what they use are standardized test scores, and they use grades. And so when you look at only those two variables, you're really going to leave out a whole lot of individuals that really could make great doctors, great physicians, right? The things related to compassion, things related to other experiences, interpersonal experiences that will make them better providers in the future. But when you focus simply on one aspect, which is sort of the standardized testing and grades, sometimes you miss an opportunity to get a broader spectrum of individuals who could be successful. So specifically, I would actually really broaden, what's valued. Those things that are valued, what experiences are valued, those sort of ethnic and interpersonal experiences that really change the way you view the world. As an immigrant myself, coming from another country, the way I see the world, or the way I see America, is very different than even those who are born here. So really looking for those experiences and really identifying what would make this person really great, what would bring better perspective to a patient in encounter and interaction, rather than, just do they have the right scores? Because at the end of the day, if you have a really good medical school, you can teach some of those things where maybe people, don't have all the information when they first matriculate.
It sounds also a little bit like maybe the admitting committees need to also have some diversity, but that's another conversation. Can you talk about the overall effect this dearth of representation has on medical care for patients today?
Yeah, there's lots of studies that I can quote here, but to summarize them, really, when you have people that are caring for you that have similar experiences, similar ethnicities, similar backgrounds, the understanding of disease process and how people interpret disease is markedly different, right? You could imagine diabetes and hypertension in the African American community and try to communicate sort of why those things are important, why treating those diseases are important, is far different coming from an African American physician versus somebody else. And so I think there's a level of comfort for the patient, but there's also a level of, really, as you mentioned before with the admitting committees, understanding that the perspectives on someone's disease can be viewed very differently based on your upbringing and your background.
And what would you say are the benefits of having a more representative physician population, especially in terms of patient compliance, follow-up, and adherence?
Right. Yeah. It's a level of trust. If you look at we can talk about Tuskegee or some of the other unfortunate sort of medical mishaps around certain communities, but some people just don't trust the government, the healthcare system, and especially in those communities that have been disenfranchised, to have somebody that has had similar experiences as you to say, hey, this is okay, this pill is okay, this appointment is okay, this screening tool is okay. It just puts people at ease, and it gives them an opportunity to really understand that somebody has their back and they're really looking to make them feel better.
And are you seeing this same underrepresentation in other HCP fields? Can you talk about that at all?
Yeah, I think it's unfortunate. I'd love to tell you that there's that it's better. I know there's a lot of work going on, but underrepresentation is really across the healthcare spectrum. I mean, from CEOs of hospitals, just to give a shout out to Wright Lassiter, he just was appointed the new CEO of Common Spirit, one of the biggest faith-based healthcare systems in the country. But all the way up from the administrative level, running hospitals, all the way to the bedside and nursing and physical therapy and physicians. It's broad underrepresentation. And as you mentioned before, even though it's multifactorial, at the end of the day, the processes by which we select individuals to go into these areas is flawed, and that needs to be significantly changed.
Your colleague Gervais Walton, I spoke to him recently, and he talked a little bit about nurses not being hired because new nurses not being hired because of lack of experience. But it's sort of chicken and egg, really, because how do you get the experience if you don't get the job? And then also, aren't graduates sort of equipped to sort of hit the ground running on the job? So that was a shocking bit of information to me. So what do you think can be done to increase the pipeline of physician candidates from underrepresented groups?
Yeah, I always start with what can be done. The first thing we always talk about, and I know you've heard it before, but like me, you're probably a little past this. The first step is awareness. But I think we're past the awareness stage. If you think of all that's gone on in the last 2 or 3 years with COVID and the social unrest, I mean, people are sort of aware. Now I think we have to get to really the brass tacks of what you do. You mentioned one thing. Can we purposefully make everywhere in our organization diverse, in medical schools, in the healthcare system? Just make a commitment to it and just do it, right? And then to your point, it may mean that you value other things besides experience. You value other things besides test scores, and you really look at a broad, sort of multifactorial way of evaluating people and put them in those roles. I think you also have to take risks. I think you have to take risks in respect to what you assume has been successful in the past for a specific position may not be the way of the future. And we saw that with remote work, that you can do things differently and have similar successes. So I think we're at the point now we have to start putting people in position, giving them an opportunity. We have to do fellowships and internships and give people exposure even before they get in the jobs in the medical schools. And a lot of what we do in the Vituity Cares Foundation, it's a foundation that we formed out of Vituity specifically to address underrepresentation and these disparities in healthcare. And what we're finding is that you really just have to go all the way down to elementary and high school and just grab somebody and say, hey, I'm going to give you these experiences early on. And so that way, when they get to the point of hire or that inflection point later on in their career, they have something that can separate them and get them in those positions. But it's going to take a lot of work, a lot of purposeful work, and more than just awareness. You're going to need to put structure behind it.
I know you do mentorship, and I agree with you. I think that this needs to begin in the high schools, not in the university, because we need to start getting young people of color to start thinking about medicine as an option and letting them know that there's something they can hold on to. There are people that are in their corner that will support them and raise them up to support them through the process so that they can graduate and get into the field. Do you want to talk at all about your mentorship?
Yeah, absolutely. Thank you. I've talked about it a little bit earlier as far as our Vituity Cares Foundation.
Mm-hmm.
And this was a foundation we started. We actually started this started the process of creating it about a year and a half before George Floyd and that incident. But once we got to that incident, we felt the groundswell in our organization and really were able to go really fast. We raised over $500,000 in our most recent gala, and specifically what those dollars will go to is mentorship, education, scholarship for individuals that are focused on sciences, looking to go into the sciences, but may not have a family member or may not have a mentor that can communicate with them about why you would go into them or why you wouldn't, frankly. And we're seeing there was a young lady that actually went to a school. We sponsored her to go to a school that was focused more on sciences, and she's now, I think, number 3 in the class. So you can really see how you can motivate somebody. We also, besides the mentorship, coaching and scholarship, is really try to create a structure in our organization where we take physicians, not just physicians of color, not just physicians from underrepresented demographics, but also those who just want to participate, and they go out and coach and mentor these individuals. So we're not there yet. We haven't totally solved the entire problem, but I feel like we have a lot of good momentum.
Okay, well, it sounds like you guys are off to a really good start, and I'm really looking forward to see some change. Get those numbers up. I mean, 5%, 5.8%. That those numbers, I mean, they're not even representative of the U.S. population. So yeah, I'm looking forward to seeing, as time goes on, that hopefully we get some payoff on the back end and we start seeing more representation in medicine, because it's becoming a matter of life and death for people of color, right? And in terms of the quality of care, et cetera, because we're dying.
Absolutely. I mean, it's, as you mentioned, this is a crisis, and it's a crisis that unfortunately has no end if we don't do something pretty drastic to change it. And there are models, as you mentioned earlier, there are models we can look at. I think if we're stuck doing the same thing over and over again, we're going to continue to see these numbers maybe even decline. So I think that we have to be radical. I think that we have to do things wild and crazy to really upend what are systems and structures that are hundreds of years old.
Well said, Dr. Tomlinson. I want to thank you so much for your time today. I really appreciate speaking to you.
No, thank you for having me. I really appreciate it. And thank you for bringing awareness to a topic that really is passionate for a lot of people in our organization.
Absolutely. Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.